Hi, and welcome to another edition of the Best Kept Secrets in Healthcare show. I'm Dr. Ray Drury. This is Dr. Hartman. And so today we're going to talk about a pretty touchy subject with most chiropractors. And but this has been this theme I've been practicing for 24 years, and it's actually seems to be a reoccurring theme more so now than 24 years ago.
Right.
And which is crazy, but the topic is, do chiropractors cause strokes? Now, like I said, it's a pretty touchy subject because I've been doing this for 24 years and we've never been anywhere even close to this. But the reason we want to talk about it now is because we've had a few patients recently talk to some people that weren't even patients, and they keep getting this scare or this fear that if they come into a chiropractor's office, if they get their neck adjusted or corrected, that it could lead to a stroke. And it just drives me freaking crazy, okay? Because I know that there's an agenda behind this fear tactic to deter people from getting the care they need, getting off of drugs and surgery, and actually getting their body working the way it was designed to work. And it drives me crazy. I had a lady come in today, or last week, and she's in her younger 20s. Her parents were bringing her in, and her doctor told her that if she went and got her neck adjusted by a chiropractor, that it would cause a stroke and she would die. I mean, I want to find that guy. I want to pinch his head off because it's just a lie. It's just a bold-faced fear tactic. So her parents told me that she's fighting us because she's like, y'all are going to kill me. You're going to make me go there and I'm going to get adjusted and die. And I'm like, are you freaking kidding me? You know, I mean, and so there's some medical doctor, and we're going to get in touch with this guy, but some medical doctor blatantly saying things. Now, we got some statistics we're going to roll through, and we're going to, hopefully you got to watch this all the way through, because there's going to be things here that'll really wake you up. If you're a chiropractor, if you're a patient, if you're someone who's considering going to a chiropractor, you need to hear this, okay? So first of all, Doc, you know, based off of even a slightest study, from what the one study I saw was the chances of you having a stroke after a chiropractic adjustment are exactly the same as having a stroke sitting in your medical doctor's waiting room, or sitting on your couch, or driving down the road, right?
And and that's pretty much the consensus. But first off, we need to discuss, you know, really the difference, especially between upper cervical doctors, chiropractors, and all the different things that they quote unquote group together as manipulation, right? So in this office, there is no manipulation. There's no twisting of the head. There's no unnecessary thrust being made. Everything's specifically placed in the right position, okay? Now with a manipulation, right, a manipulation means to extend a joint through the physiological space without exceeding the anatomical limits, okay? That's not a correction. We would never call something that has that definition a correction. We're here to correct the vertebrae and place it back into the proper position. And Dr. Drury, just like you said, you know, the statistics show, you can go into all the numbers, but you've got about the same amount of chance of having a stroke from after your chiropractor, let alone upper cervical doctor's visit, as you do waiting in the doctor's office. Now they've included that into, you've got about the same amount of chances dying from electrocution, dying from being struck by lightning,
right?
Okay, being hit by an asteroid that comes down, and then really even on top of that being, you know, dying from a car accident. Those are about the statistics equivalates to having a stroke from your chiropractic visit.
Now, when it comes to some of the studies that have been done, it was kind of humorous that we were looking at this as what they consider a manipulation, right? And who they consider to give manipulations when they do these studies, and who was it?
Right. So it's funny, and all this is, you know, medical research. This isn't any research from chiropractors or upper cervical doctors, but basically they call it, you know, spinal manipulative therapy. Right, so
who do they classify as
SMT? So they group all those together, right? So whether that's considered an upper cervical doctor, as the most specific that it gets, to a general chiropractor, to physical therapists, they've included physiotherapists. All right, they call them kung fu practitioners. That's what we get grouped into. Blind masseurs, right? And then Indian barbers, I think, was one of the most comical that actually do, cervical manipulation to people. But that's the category that we get grouped into, and which is so crazy. And even those statistics prove that you're less likely to have a stroke after seeing an Indian barber than you would going to see your medical doctor or general practitioner. That to me, I think shows a lot.
So the bottom line is the chances that, so I wanted to point out that there's actually a whole chapter on this in my book called From Quacks to Facts, okay? And it talks about back in '76, the American Medical Association actually came together and forced the medical doctors, told the medical doctors to go out and spread and defame chiropractors, right? And tell them that chiropractors cause strokes, chiropractors kill people. And from what I understood in the research that I did, there was actually a physical therapist and a DO that did general gross manipulations with no x-rays, no information to determine when they needed, if they needed it or not. And what happened was, over a period of years, 2 people died. So what they decided was, well, spinal manipulation of the neck could kill people. I mean, heck, we see that in Bruce Lee movies, right? That could kill somebody if you do it the wrong way, right? Sure. I mean, you'd rip somebody's head off. Of course, there's nothing like that done in chiropractic offices. So what they did was they said, well, twisting of the neck, manipulation of the neck could kill someone. So anyone who does manipulation of the neck cause strokes. So we're going to say chiropractors do manipulations cause strokes, so chiropractors cause strokes, and we're going to go out and tell everybody, don't see a chiropractor because they cause strokes and they kill people, okay? So now they're still saying that, even though we won the Wilkes case back in '76 that says the medical profession basically admitted that that's what they were doing, and so we won a case, a cease and desist, they had to stop doing it, but they haven't stopped, okay? So they're still doing it. Now, the studies show that it's a complete joke. Now, let's go another. So the media, right? They understand the media is pretty much owned by the medical profession. 80% of all media is owned by the pharmaceutical industry, right? So if you noticed, if a patient walked across the street from our office, from a chiropractic office, and had a stroke, front page of the paper, right. Patient has stroke in a chiropractic office, okay? That's the way the media works, right? But the one things that you don't see are things that you should look up, like this article called Death by Medicine, which was put together by 2 PhDs and 3 MDs, medical doctors. And if you want to know the truth about how people could die, you should take a look at this. So, for example, adverse drug reactions. How many people die in the United States just from adverse drug reactions? 106,000 people a year. Medical mistakes, 98,000 people a year. Bed sores from laying in the bed in the hospital, 115,000 a year. Hospital-induced infections, over 100,000 people a year. All in all, from following your doctor's instructions, 784,000 people die a year in the United States from going to medical doctors. Maybe somebody had a manipulation of their neck years ago by a PT and had a stroke, but 784,000 people a year are dying from going to your medical doctor. Do you hear that?
Right, and that's the big thing too. Just to revert back before I take away from obviously something that we're both passionate about. God. We have to know the difference between causation versus correlation, right? And just some of the studies that we found, he likes to group it together and give you basic analogies, right? There was one that showed the correlation between people that drank cottage cheese. That number rose as the same amount of people that had motor vehicle accidents. That number was actually correlated to the same thing.
So if you eat cottage cheese, you're more likely to have a car accident?
Yeah, specifically motorcycle accidents was a specific one. I guess there's a correlation there.
What does the cottage cheese do to motorcycle drivers?
Not sure, it makes them lethargic. Anyways, so and then the other one that I thought was humorous was, it was this autism actually was correlated directly to organic food sales. Do you see where we're going with this? Just because someone may have had an injury a long time ago, then they went to their other doctors. Most of the time, this is where we see people on their last result right? And Dr. Drury's been practicing a long time. I don't know if you've known anyone that has suffered from a stroke coming to this office. I don't
Never.
think so, or we wouldn't be talking about it. However, they go through the whole circle, maybe for 10 years or so, happen to grace a chiropractor's office, and then all of a sudden, a few days, maybe a few weeks later, has a stroke, and then we get under the blame that it was that chiropractor or that adjustment, quote unquote, that caused a stroke. It's just ridiculous. It's frustrating. And you know, if you've got this stereotype of your friend's sister's uncle's cat's caretaker that had a stroke under a chiropractor, don't listen to that garbage. Get the facts, get results, and yeah, we'd love to take care of you.
Well, so one thing I want to point out, two things actually, before we go. So one thing is, you know, when you have a misalignment in the upper part of the neck, if those vertebrae get twisted, they actually impede the blood flow to the brain, okay, which can, if left long enough, starve the brain to the point it can actually stroke, okay? What we do as upper cervical doctors is we open the communications up. That's our job. That's what we do. We do very specific analysis. So we open the communication. If anything, we actually improve blood flow. There's no telling how many strokes we've actually prevented because we were able to open up, like long-term migraine sufferers. They have migraines because the bone's out of line. It's inhibiting blood flow to the brain. As upper cervical doctors, we open that up, improve blood flow to the brain so we can lessen the chance of migraines, lessen the chance of a stroke. I bet you there's hundreds, thousands just in this office of strokes we've prevented, but yet the medical doctor wants to say that we actually cause, okay? Here's the other thing I want to point out. This is very, very important. If you go to any major city in the United States, you'll find the largest buildings are the banks and the insurance companies. And we say that the banks have to be big so they can hold all the money for the insurance companies, okay? You know that insurance companies are not in the business of losing money, right? Now, you tell me if chiropractors actually could injure people, okay, my malpractice insurance, and I've been in practice now for 24 years, is $800 a year. $800 a year, okay? That's cheaper than most car insurances. Right? Do you think the insurance company has realized that they're not going to wind up probably spending much money defending chiropractors because or else they're going to lose a lot if they're paying out all of these settlements for chiropractic strokes? Then obviously they're not going to make much money.
Right.
So if you that's kind of the bottom line on this thing. So this is what I want you to know. There is an agenda by other healthcare organizations to try to scare you into doing what they want you to do. If you hadn't realized, everything they do is based off of fear. If you don't take this pill, you could die. If you don't do this chemo, cancer's going to kill you. If you don't, everything's based off of fear. And so they use that fear to manage you, to manipulate you, literally, into doing what they want you to do. And one of the things they want you to do is stay in their network. As long as you're there, then you're going to take their drugs, you're going to do their surgery, and they're going to continue to be fed through you. If you leave their network and you go somewhere, then there's a chance of you getting well and no longer needing their drugs and their surgeries. That's the agenda. I hate to be as blunt as I am, but that's the agenda. So don't listen to it, okay? Do the research yourself. Get a copy of this book. If you would like, just send me an email. Call the office. I'll mail you a copy of the book and no charge. The book retails for $17.95. We sell it in the office. It means enough to me for you to get the truth. I'll give you the book. Call us. I'll give you a book. Got anything you want to add?
Absolutely. Well, please feel free to share this video, of course, and you know, don't let your doctor continue to do malpractice on you. If he does know and doesn't take the time to look into something that actually could benefit you and the results that you're not getting, then in our opinion, I think that's malpractice. I would never talk harshly about something, especially if I don't know anything about it. So yeah, with that being said, please feel free to share this video, especially someone that has having hesitation of visiting a chiropractor or an upper cervical doctor because of they're afraid of strokes. You know, do the research, listen to this video, share it, and we'd love to see if we can help you out.
By the way, 784,000 people a year that die from following their doctor's instructions, 784,000 people. That is 6 jumbo jet planes crashing in the United States every day. 6 747s crashing every day in the United States. That's the truth that you need to know. Don't worry about a couple strokes that happen because some random manipulation by a physical therapist. That's the truth. That's what you need to know. Look it up, death by medicine. Thank you guys for tuning in to this episode of the Best Kept Secrets in Healthcare. The secrets you're not going to hear anywhere else. I promise you, you're not going to hear this anywhere else. Thank you for tuning in. Please share it with other people. Go to our YouTube page and subscribe, and you'll get the latest and greatest, newest information on healthcare every week. Thank you guys. Have a good afternoon.